Next is the heat-related emergencies. What are heat-related illnesses? These are exposure to abnormal or prolonged amounts of heat and humidity without the relief or adequate fluid intake, which can cause various types of heat-related illnesses. Children and teens adjust more slowly than adults due to changes in the environmental heat. They also produce more heat with activity more than the adults and sweat less. Sweating is one of the body's normal cooling mechanisms. Children and teens often do not think to rest when having fun and may not drink enough fluids when playing, exercising, or participating in sports. Children and teens with chronic health problems or those who take medications may be more susceptible to heat-related illnesses. Those who are overweight or wear heavy clothing during exertion, such as marching band or football uniforms, are also more susceptible. Just so you know, there are three types of heat-related illnesses. These are the heat cramps, heat exhaustion, and heat stroke. First is the heat stroke. Heat cramps, rather. The heat cramps are the mildest form of heat illness, and it also consists of painful muscle cramps and spasms that occur during or after an intense exercise and sweating in the high heat. An individual with heat cramps may have the following symptoms, such as the painful cramps, especially in the legs, flushed, moist skin. The first aid and treatment for heat cramps are first to move to a cool place and rest, and do not continue to participate in the activity. Remove excessive clothing and place cool cloths on skin and fan the skin. Give cool sports drinks containing salt and sugar. And then stretch the cramped muscles slowly and gently. Next is the heat exhaustion. Heat exhaustion is more severe than the heat cramps and results from a loss of water and salt in the body. It happens in conditions of extreme heat and excessive sweating without enough fluid and salt replacement. Heat exhaustion happens when the body is unable to cool itself properly, and if left untreated, this can progress to heat stroke. With heat exhaustion, you can have the symptoms, which are the muscle cramps, pale moist skin, fever over 34 degrees Celsius, nausea and vomiting, diarrhea, headache, fatigue, weakness, anxiety and faint feeling. And then the first aid treatment for heat exhaustion are also to move to a cool place and then rest, remove the excessive clothing and place cool cloths on skin, and also fan the skin. Give cool sports drinks containing salt and sugar, and if there is no improvement or the body is unable to take fluids, you have to take your child or an individual to emergency department because they need intravenous fluid for the body to have an improvement, or it is able to take the fluids. Then lastly is the heat stroke. This is the most severe form of heat illness and happens when the body's regulating system is overwhelmed by excessive heat. It is a life-threatening emergency and requires immediate medical attention. With its symptoms are the following: warm, dry skin, high fever usually over 104 degrees Fahrenheit or over 40 degrees Celsius, rapid heart rate, loss of appetite, nausea and vomiting, headache, fatigue, confusion, agitation, lethargy, stupor, seizures, coma, and death are possible. With heat stroke, these are its first aid and treatment. First is to move to a cool place and then rest. And you also have to call 911 or your local emergency medical service. Heat stroke is a life-threatening medical emergency and needs to be treated by a doctor. Then remove excess clothing and drench skin with cool water and fan the skin. Place ice bags on the armpits and groin areas. Offer cool fluids if alert and if the patient is able to drink. And tips on how heat related emergencies to be prevented. First is to drink plenty of fluids during vigorous and outdoor activities, especially on hot days. Drink of choice include water and sports drinks. Avoid alcohol and fluids with caffeine, such as tea, coffee, and cola, as this can lead to dehydration. Then make sure your child dresses in light colored, lightweight, tightly woven, loose-fitting clothing on hot days. Schedule vigorous activity and sports for cooler times of the day. Take rest periods in shady or cool areas. And make sure your child is protected from the sun and wears a hat and sunglasses and uses an umbrella. Use also a sunscreen that is at least SPF 15 and increase time spent outdoors gradually to get your child's body used to the heat. Teach your children to take frequent drink breaks and went down or mist themselves with a spray bottle to avoid becoming overheated. Try to spend as much as time indoors as possible on very hot and humid days. Then teach your child to warm up and cool down before and after exercising. And if your child has a medical condition or if he or she is taking medication, consult him for to go to the his doctor rather for further advice for preventing heat related illness. That is all for heat related emergencies that you need to know.